Hi, and welcome to our first episode of HSUP TV, brought to you by the Faculty of Health Sciences. Today we're going to be talking about the coronavirus, and our experts are going to give you more information about this viral outbreak. Now, in terms of our experts, firstly we have Professor Wanda Markotter, who is the director at the Center for Viral Zoonosis based at the University of Pretoria. She'll be joined by Professor Marietjie, who is head of the Zoonotic Arbo Respiratory virus program. And lastly, Professor Anton Stoltz, who is the head of department of the Division for Infectious Diseases at the University of Pretoria. Thank you so much, colleagues, for joining us today. Now, getting straight into business, Professor Wanda, can you provide us with information on the new coronavirus and its development in the recent months?
So this virus was first reported from Wuhan in end of December. The reports came out that there's some serious ammonia cases and they don't know what is the cause. And then a few weeks later it was actually identified and they saw it was a new virus. It wasn't a coronavirus that we've seen previously, and there was some links to a seafood market in that province. We don't know what in the seafood market, and seafood is maybe a complicated term. This is not a seafood market as such, it's an animal market where there's lots of animals being sold, which can be domestic wildlife, there's humans. So the source could have been anything, but they knew there was a link. And then they first thought it was just a jump from probably animal species, but then it became clear that it can spread from person to person also, and that made it a very worrying outbreak. And then there's been cases reported outside China after that. What we need to take into account is that 99% of the cases is still from that specific area. The rest is limited spread.
Thank you, Prof. Now, Prof. Marietjie, how does this virus differ from the common cold or flu and the other human coronaviruses that we've seen in the past?
So there's many respiratory viruses that affect people that can have similar signs, okay? And so every year we will get cases of influenza, which is flu, or of the rhinovirus, which is a common cold. But there's also coronaviruses, that's just human viruses, that normally also present just with a common cold. So there's one that's called OC43, 229E, NL63, HKU1, and so those were all human viruses, and they, in general, they will just present with cold-like symptoms, but sometimes they can also cause pneumonia and a little bit more severe disease. However, at the moment, this new virus, the fatality rate is about 1%, between 1 and 3%, so it's relatively low. Although it's human-to-human transmission, at the moment it also doesn't look like it transmits to the level that influenza transmit, for example. However, the other coronaviruses that were described in the past that were worrying is one called SARS that was described in 2002, and that was shown to have come from bats and then to civet cats and then probably to humans. And then there was one MERS coronavirus, which is still active in the Middle East, and that was thought to come from camels or bats and then to humans as well. And both those viruses have limited human-to-human spread, but they have a very high fatality rate. So SARS was eliminated from the human population by doing isolation of cases, and today you actually don't find it anymore. But there's related viruses that can still be found in bats. So this new virus, it's unclear, as Wanda said, which species it came from, but they probably came from an animal and then to humans. So at the moment, the human population is what we will call naive. We haven't seen it before, and that's why so many people are susceptible to be infected. However, most of the cases are still mild, so it's similar to the common cold, and then some cases where people have are more immune suppressed, or older people can develop more severe disease, and those are the ones that's worrying to us.
Okay, now I'm going to direct this question to both you, Professor Marietjie, and Prof. Anton. In this kind of instance, how are you able to create a vaccine to control an outbreak of a virus like this, or how do you even create a vaccine just in case it breaks out outside of Wuhan, China?
So at the moment, there's no vaccines to any coronavirus. Okay, the first place, the common human ones, there's not really a need for a vaccine because there's not as many cases and they weren't as severe. While the ones for MERS and for SARS, there's some experimental vaccines, but it has never really gone into advanced clinical trials and use. However, they do have some experience what they developed for MERS and SARS, and so they will look at similar methods to develop a vaccine for this virus. So for example, you look at the surface protein, so you don't use the whole virus, you just use the surface protein, and then you put it in a what we call a vector that can induce the immune response, and then the body will only see that surface protein, so it looks like the virus, but it can't cause disease. And so there are some of those type of vaccines in trial, but I think that it will still probably take some time. There's many of the other corona or the other respiratory viruses, such as respiratory syncytial virus, that has been in development for 50 years, and there's still hope of a vaccine, but it's not available yet. However, on the other hand, the influenza vaccines is very well, the system is very well developed, so when they see a new vaccine or a new virus, it's easy for them to develop a new vaccine. But with the coronavirus, I think the verdict is still open to see how easy it will be to develop a vaccine.
Prof. Anton, would you like to add to that for us?
Actually, there's not much to add to this. I think, there was a lot of things written about it, and there is speculation that they will develop a vaccine. But, having looked at what happens to SARS and MERS, it was not so easy. So, but as it is a novel virus, so one can just hope that one will develop a vaccine. But once again, we will have to wait and see. The literature is not clear on this.
Okay, and now to Prof. Anton and Professor Wanda. Obviously, with this kind of outbreak, there's always rumors, there's always panic, and people spread incorrect information. Which information source would you recommend that the public engages in to get the correct information regarding the developments of the coronavirus?
I think the best at the moment is that we need to go to NICD in South Africa. I think we have a very good source at the moment. There's a new document that came out actually this morning. I saw it for the first time. Really, they took a lot of care in addressing every aspect, from home care to who should you contact and things like this. So it's important to realize that I think from country to country, these things will differ. I also read the WHO situation reports, the SITREPs. I think it comes out almost every day now. And at the moment, I think, they're quite good. They also have some articles on there that will talk about home care. They'll talk about, for the professionals, how to treat it. As we know, there's no treatment, but what you can do and what is known about it. And several things about infection control, which is perhaps the most important part of those things. And then there are several websites that you can actually visit, and everybody that wants to make a video is making a video at this stage.
Like us.
I think maybe to add to that, so we must remember this is a new virus, so we don't know everything. So we're also getting new information from the scientific community that is updated in these documents on a regular basis. So it may also change, but where will you see the changes that you can actually believe is in the WHO documents and the NICD documents. That's where the updates are being made.
It's actually very interesting. I was giving a lecture yesterday, and from yesterday into the lecture that I will give today, there's already about 4 changes. What I will tell people of what is happening. How do you identify a case? Because we have spread outside now China, I mean, the way that we're going to look for these people that might be infected, that will change, and that is changing the whole time. As we get more information, those things are updated constantly.
Okay, so great. Thank you, professors. Now, Professor Wanda, at this rate, obviously, the virus has been contained in China. They've shut down a lot of things in that country. But from your end, what do you know now about the spread of the disease, and who are the people most at risk? I do know Prof. Marietjie did mention a few, but who are the people most vulnerable to potentially catching the coronavirus, or this new coronavirus that we're experiencing now?
So at the moment, it's a human virus. So it's in the human population. In China, it's spreading between humans and then through travel to other parts of the world. So for us, the risk is a traveler coming in with the virus and then not containing it quickly enough. So the important thing is identify those people, be able to diagnose them as quickly as possible, and get them into a quarantine environment where they can't spread the virus. that will be the way to contain the virus outside China at this moment.
Like Wanda says, it's very important for the public to still remember that our risk here is still much lower to get this virus than to get the common flu. So, people should rather make sure that they're vaccinated to flu, that when our winter actually shows up, you don't present with those type of signs and you think you have this other virus. Okay, so, but most people, your risk in South Africa is still very low. It will be coming in the first cases with someone that had exposure or came from China. It will not be just when you have a cold, assume that you now suddenly have the coronavirus.
Sorry, can I just add something to that? I think the spread from human to human is very important. And I think contact spread is very important. As I sneeze or cough, what will happen is that there will be particles lying everywhere. And if I touch it, and most of us will touch our faces a few times per minute, that is the way it's transmitted to your face and into your mouth and nose. But also droplet spread. Now, the droplet spread is for us very important when I see patients, and therefore, when a patient comes in, I would put a normal surgical mask on the patient to prevent those droplets from actually reaching us. Now, we know it's not 100%. The question is this organism airborne at the moment? Now, if you look at SARS and MERS, yes, they are seen as airborne pathogens, but they are talking, WHO is talking about droplet nuclei. Now, droplet nuclei actually tells you that the particles are quite small. They're around about 5 microns, 1 to 5 microns in size. Those particles can hang in the air and then it becomes a true airborne infection. But nobody has talked about a true airborne infection in this case yet. But I think that is where we will go to. But at the moment, contact spread, very important. Wash your hands, that is very important. Because I mean, when it falls onto the ground on a table or in the aeroplane and you touch it and you touch your face and then the droplet, do not come near other people if you don't have to come, especially if they're ill and especially if you are a healthcare worker looking after patients, make sure that they do not cough on you. Okay.
Wow, that's a tough one. But, but then I'd also want to actually direct this question to Professor Marietjie. When does one know it's time to actually see a health practitioner? Does it come through obviously as flu, cold-like symptoms? When do you know that it's time to actually go get myself checked in because I'm not feeling well and I might have this coronavirus that we seemingly still learning a lot about?
Well, I think Professor Stoltz can maybe also take that question, but it's most cases, like I said, will be mild. And if you have a common cold, are you going to go to the doctor for that? Likely not. So you should see this similar, except if you really had contact with a patient that you knew had this coronavirus or that had a recent travel history to China. Then you will maybe, if it was a mild case. But otherwise it will be a more severe case. So if you have flu-like symptoms that you really feel sick enough that you would want to see the doctor, yes. But lower respiratory tract infections is probably when you actually go to the hospital is more likely to be the ones that the doctors will see. But, yeah.
So I think it's important to realize that the person that is infected or might be infected have responsibility. That responsibility is to tell the doctor or the healthcare professional, listen, I was in contact with someone. I was in a country where where the outbreak is. So I've been in not contact, but I have seen now 4 cases eye to eye. I have seen 4 cases in terms of talking to them over the phone and then decided to put these patients basically at home where they will wait 14 days. I do not have to see all these people, but 2 of them I had to test. So it is the important thing that a case definition must be followed. Otherwise, what will happen is that if you don't do the case definition and you do it accurately and they change, what will happen is that we will overflood the whole system and then the NICD will not be able to cope with this huge amount of cases that they will see. The panic outside, I think, is not good at the moment because they are panic, and I do get a lot of calls from people, from mothers, from fathers, and even people from China. So it is important to realize that, like all the other panelists said, is that this disease is not always a fatal disease. Only about, like I said, around about 1 to 3%, and at the moment it stands at 1.7% can be fatal. 20% of people will get severe disease, and those are specific people. All right, so it is in the rest, the 80% is basically mild disease. So, but what is important to me is that people outside is, they know that they can phone someone and ask them questions. Okay, so we have even in a case last week, we actually phoned to China to find out if the person that he was in contact with, the patient, is ill or was ever ill, and it came out no, was not ill. Immediately you drop your suspicion of this patient being infected with the coronavirus.
All right, thank you, Prof. Anton. Now, Prof. Wanda, if it were to happen, which seems like it would be very hard for this to occur, for the corona outbreak to maybe reach schools or a university, because you know that respiratory diseases spread quicker amongst young people because of the daily contact, how would you think institutions would handle that kind of outbreak?
So I think the first thing is we shouldn't get into that position. And I think that's the same rules that Prof. Stoltz also talked about now. If there's sick people, even if it's the normal flu, you shouldn't go to work, you shouldn't go to school, you shouldn't go to class. You should stay away in your house till you feel better. And then these basic rules of hygiene, where we have hand washing. If you cough and sneeze, try and keep it away. But we shouldn't be in a situation where sick people mix in any area where there's gatherings for any disease. And I think that will be our standpoint, and also monitoring people visiting China. I think that's important, and just answering questions like Prof said. You know, if they were in contact with a sick person, try and keep them away for the incubation period.
I think if the history is an adequate history to say you might be infected and you get now cold symptoms, please do not come to the university and stay away. Ask the questions from the experts, and then you can make a decision, or we will help you make that decision. And if we will test you, you know, so nothing more, nothing less. So nothing to panic about at this stage. So I think that is the way. And I think, Wanda, you're absolutely right in saying that things like hygiene is much more important. The way you cough is very important. The way that you wash your hands and things like this is really important in all of these airborne pathogens, okay, and the viruses. I think that's the point.
Yeah, I think HR might have a problem with me saying that, because now if I have a little cough, I'm not coming in the office. Now, Prof. Marietjie, do you have any idea where the general public can turn to for help? And after that, Professor Anton, if you can also shed some light, how has South Africa prepared for any potential outbreak? So we'll start first with you, Prof. Marietjie.
Well, I think in the first place, we are currently not in the influenza season, we are in summer. So it also makes it a little bit safer for South Africa at this stage. But it's very important that people go for the influenza vaccines this year, so that they protect themselves firstly from co-infections, but also from the panic that can arise if there's influenza outbreak and you then think you have coronavirus. Okay, so but there's good information with NICD. They actually have a helpline, so if it's a real true case, you can also contact the helpline. As Prof. Stoltz says, the university can actually handle cases, but at Steve Biko Hospital, so I will give that to him. I think that although we are happy to take questions, we also don't want the public to phone, everyone to phone us now, because there's lots of very good information on the website. However,
Yes.
if it's real cases, we obviously are happy to help.
Thanks, Prof.
I can perhaps say that I'm getting more than 50 calls a day already.
Oh, my
So
soul.
oh my soul. Most of them are the mothers that's asking questions about the children and things, and it's okay. I mean, it's good to have information. Now, you know, I think the best information is, like we all say, go to the NICD website, have a look and see what I mean, we all can read, you know. So, and I think that it's important that everybody have the responsibility to actually know more about the virus. I mean, then what you can do is you can prepare yourself and have a good history. Do not travel to China now, I think, except if you must, and you know, stay away from people that's ill. And then vaccination, I think that's a very important thing. People don't realize how important the vaccination is, and only people that's allergic to eggs is not allowed to have basically the vaccine against the influenza.
That's an interesting fact. I didn't know that. Now you learn something new every day.
Always learn something new every day.
Maybe to add to that, I think it's also important that people shouldn't create this panic on Facebook and social media based on things that's not on these factual websites. And we should also stay away from that, you know, as people who's educated at the university, use the information that we really can trust.
Yeah, I agree with you.
Yeah.
So,
I think the Facebook is very powerful, but look at your sources. You know, there's very good sources from the WHO and from CDC, and NICD actually have a list there of frequently asked questions that will answer most of the questions that you have. And don't believe all the nonsense that's on Facebook.
what is actually good, is that I don't have time to read Facebook, so it's excellent.
And obviously, hopefully no chain messages to people that if you do not send this to 9 people, you will catch the virus. Yeah. So thank you so much, colleagues, for spending time with us and sharing some insight on the coronavirus. Thank you for joining us on our first episode of HSUP TV. We hope we can inspire you to become a life changer. Most importantly, please remember to click the subscribe button down there, because we've got a lot of more information and experts that will be joining us throughout the course of the year, and they'll be sharing insights. We'll be having these kind of conversations. Feel free to comment with any recommendations and questions that you may have, that we can help you understand better about the coronavirus. See you same time, same place next week. Thank you.